So this is then in order of the overall column. We broke it down on these slides by physicians, residents, and nurses, but keep your eye on that overall column because it's ordered from high to low there. So it gives you where some of the biggest changes were. And this is, in the Rochester study, I don't even think we had this item. We totally reworked the Rochester survey and added a lot to it. But it was the advice given to patient or family. Almost half of them are changing that as a result of the information from the library. Well, like, woohoo! I mean, this is a great impact to have because we know that it is so crucial in our current healthcare environment that people be involved in their care and that we have good communication between healthcare providers and patients and families. Like, wow, this was so exciting. But then the more usual choices, choice of drugs, choice of other treatments, diagnosis, choice of test, post-hospital care or treatment. These were all the highest ones. We had other ones as well. And even though some of the percentages for the other things might be lower, they are still significant. So again, breaking down this concept of value. What makes something valuable? Is it relevant? Is it of clinical value? Is it accurate? Is it current? Will it be of use in the future? Not just a one-time use thing. And will it refresh my memory of details or facts? Because in a changing healthcare system, changing knowledge base, people often think something, but it might have changed. So that's a really important thing to get at. And as you can see, these are all incredibly high for all of the health professionals. So, woohoo. So we had more statements that they were asked to agree or disagree with. And as you can see, very high percentages said that the information contributed to higher quality care, provided new knowledge, which is different from confirming old knowledge. Both are valuable, but it's nice to tease that out. Resulted in a better informed clinical decision, substantiated my prior knowledge or belief, which is important, and did having the information save me time. So now that's one that we can turn into dollars because we know how much these folks earn and we know how much we earn. So we can actually use that. So if information saved time, how many hours? So the average, the mean was 2.6, the median was 1. It was a big standard deviation. So sometimes it was just a little bit of time, sometimes it was a lot of time. But the main thing is that we are saving those, not just by going to the library and using the librarian, by the way. This was in terms of accessing information resources provided by the library. Okay? So, and as we all know, the game has changed, and you know, it's in the 90s, it was all about intermediary searching in the early 90s, and the Rochester physicians were asked to go and ask their hospital librarian for a Medline search. So it was as much the search skills of the librarian that were being measured as it was the resources that the library had available to it. But this, we asked them how did they get to the information, but we were very aware that a lot of it could be end-user searching. And that was the way, and one of the major ways in which we felt, you know, our environment has changed. The healthcare environment has changed. The information technology environment has changed. So the study had to change as well. But still, this is a very good outcome and one that we can, if we choose to, turn it into that value in exchange or dollar value. So as we know, adverse events are a key thing in healthcare. They're very costly to the healthcare system. They're very costly to people who experience them. So we did ask for that, and we asked about adverse events avoided. So again, there's patient misunderstanding of the disease at the top of the list. And again, I think that's a really great outcome for us to have. Additional tests or procedures. You know, we could start to quantify some of this adverse drug reaction. I mean, we could try to find statistics on, you know, what's the average costs of tests and procedures, and you know, it'd have to be estimates. But economists do that all the time. They don't have really specific data. They come up with estimates. So, you know, we should be able to take these results and then actually, you know, quantify them if that's what's required. Misdiagnosis. Medication error. We all know these things happen, but what the health professionals are telling us that in a significant proportion of the cases, these things are avoided through the use of the resources that the library provides. And there were others on the list, but I just put on patient mortality even was towards the bottom, because even if in 5% of the time someone's life is being saved, I mean, libraries do save lives. There's the evidence right there. So we also, remember, this was a situation in which they were asked to use essentially resources beyond what they would normally go to, which essentially means going to the library resources. And then, but we know that they discuss with colleagues, they use lab tests, they use diagnostic imaging, other sorts of things, and that these are all extremely valuable sources of information. But when we narrow this down to situations in which people have used library and information resources, it's a critical incident, they have an important information need, they use library and information resources. In that critical incident, how valuable did they, what value did they assign in terms of importance to the library information resources versus those others? Discussion with colleagues, lab tests, diagnostic imaging. And 92% said the library was the most important. The others are still very important, and they could check more than one, and they did. Like, they were using multiple sources. This always happens, you know, in the healthcare system. And other studies, you know, we get so depressed because, you know, there'll be this list, you know, did you get the information, you know, from a colleague, from a drug rep, you know, from, you know, some other source, from the tests and all of the other things that they have available to them for diagnosis. And the library is really near the bottom of the list in terms of actually its use within that, because these other things are so routine. I mean, they just almost do those without thinking, you know. But the library information resources, it's in a different category. It's often for those things which are extraordinary, or for things, of course, where they're keeping up to date. But we asked them to base this on one of their extraordinary situations. And in those situations, which are absolutely critical, I mean, these cases are among the most challenging and important that healthcare providers deal with. They said the library was extremely important. So it's often how you conceptualize these things and then turn those into the questions that you can answer people. I mean, we just had so much fun in this group. It was just wonderful working with these librarians from the Middle Atlantic region, and we would meet in New York City, which was also pretty wonderful. And looking over the East River there and just talking about this and hearing their experiences. So this is all grounded in the work that we all do in our day-to-day work and the way that we think that things can be measured. And we have a lot of insight into that. So we also looked at it, we sort of created a scale where 1 is not at all important and 4 was very important. And we sort of each of those sources came up with a score, essentially. And it went from, as you can see, again, it's a little different when you use the mean score, but we still came out on top. Okay, the others were just the 2 top categories collapsed, very important or very important. Okay, so in the actual survey, we actually spent a lot of time at the beginning asking, first, you know, what did the clinical case involve? We didn't want to get involved with, you know, getting information about patients, because that's a much more difficult study to do, to get actually access to the charts and things. But we asked them the area of the clinical diagnosis of the patient, and then we asked them about what sources they actually used, and for each source that they used, we asked them a bunch of questions about it. And so that came first, and so that got them thinking about the critical incident again, and the patient case involved, the information sources that they searched, and then they went on to the value questions. But the first time I presented these very, very early partial pilot results at the Middle Atlantic region, the librarians are sitting there looking at all of these library resources results and saying like, okay, when is it coming, when is it coming? So I moved up for MLA, I moved the value stuff to the front, but now you have to, this is the meat and potatoes really. So, okay, so how many sources, library and information resources, were the physicians using or the nurses or residents using? So they were using a number of different sources, not just PubMed, not just, you know, one source or up to date. They were using a variety of sources, an average of 3.6. And but the top ones that were used, and this, I think, information will help us a lot when maybe in hard decision-making times when we have to say what's the most valuable, and also help us look at, you know, say the use of online versus electronic. But top was the journals, and then PubMed, Medline, and then up-to-date, expensive but much used, and books online, still used. I mean, if you want evidence that books are still used, here it is. And micromedics was the fifth. But we have a lot more data on that because we had a huge long list of resources. Now, not all of these are in every library, of course, so, but certainly all of these are available in almost every library. So, but for some of the others, the more specialized ones, when the individual sites get back their results, they'll be able to look at those. That will really inform their own collection development. So other ones, the next one on the list was Ovid Medline, eMedicine, print books, still 20% say they use print books. They're not really going away yet. MD Consult, print journals, and Hippocrates. Those were the top 10. Okay, so what else were they using? Things like professional association websites. 9% mentioned clinical evidence, the BMJ resource, the cumulative index to nursing and allied health literature, only used by 8% overall, but 18% of the nurses. And it's interesting because what this shows is that the nurses are really using a variety of resources. They use a lot of the same ones as the physicians and residents. It's not just CINAHL and the Nursing Reference Center, which are the two most used nursing resources. So I think there's a lot of data to be analyzed here about the nursing group, and we'll have a very substantial number of responses to analyze, and then Dynamed is near the bottom. But you know, again, this is overall, and not all the sites, not all 7 sites had all of these resources. So, you know, that's fine. They searched. Did they find the information they needed? So here's what they've told us. 58% completely, another 21% partially, due to time constraints. So we all know about that in the clinical environment. And, you know, partially information, the information was complete for some reason, not just because of the time constraints. And partially for some other reasons. So, you know, again, that's something we could start to investigate as, you know, we'd like everybody to completely find the information that they need. But, you know, sometimes the reason they're looking is because they don't think it exists, but they want to make sure it doesn't exist before they make that assumption. So it's not all going to exist. We're never going to know everything that we need to know about patient care, for sure. But it's pretty good. It looks pretty good. The nurses are a little lower on some of these things. So again, I think trying to figure out what those nursing information needs are and trying to refine things for them. Okay, so here's a really important one. Where were they using these resources, library and information resources? So the first two, I think, are kind of interchangeable. The highest proportion, over half, were using this through their institution's library website, or what they call their institution's intranet. And we had those two choices because the pilot group said there were different ways in which the library information resources were mounted in their institutions. And that if someone said the library website in their institution, if they had it up through this so-called intranet, that, you know, people wouldn't say they were going through the library. And if they had it, you know, if the rest said, well, if it was on the internet, they'd think they're coming to the library website. We all know some of the problems of identifying library-provided information these days, given the electronic nature of these things. So those are pretty much interchangeable. But a search engine such as Google, okay, this is one of the things we struggle with. So a very high proportion, well over a third, say they're getting it through Google. But then you have to say, well, what's happening when people within institutions search Google? Very often it's leading them back to the library. So, but this does give us some data on what's happening there. Personal and departmental subscriptions, it seems, are still around. 17% are doing it in their institution's library. Okay, 17%. So it's different. It's where the rest, you know, they're coming in all sorts of different ways, but they're not necessarily using the physical library as the access point. Medical record, there are some now that are getting these things through the medical record. Only 14% so far using mobile devices. And all I can think of here is that there still are a lot of security problems with these in clinical settings, but I expect we'll see that this increase. And 9% asked a librarian or library staff member for assistance with the search. 9%.